everybody, welcome to my YouTube channel. This is me, Jamie Naftali, on the pediatric world. This is the only channel whereby we talk to mothers, to caregivers on common illnesses affecting children while growing up. We talk in a language that everybody is able to understand. So I welcome you to this episode. If you have not subscribed, please subscribe to become part of this wonderful family. And if you are that returning subscriber, thank you so much. I'm much grateful for your support. So without further ado, let's go to the video of today. And we are still continuing on TB in HIV in children. So today we are treating the TB. Remember, we started on the pulmonary TB as an opportunistic infection when it comes to HIV. So we've been learning about tuberculosis. Now today we want to see how we treat tuberculosis. So to start with, clinical diagnosis of pulmonary TB in a child's Kenya guidelines states that the presence of two or more of the following: one, cough for more than 2 weeks. Not the word more than 2 weeks. It has to be more than 2 weeks. It's not just cough for 1 day or 2 days. So cough for more than 2 weeks, weight loss or poor weight gain. Another thing is persistent fever. That is hotness of the body that is constant. It has been constant and also persistent. And night sweats for more than 2 weeks again. So if there is presence of one or two or more of what we have said, plus the presence of, again, two or more of the following. One is the history of contact with adults with TB or the chronic cough. These are very important history, a good history to us. Whenever you are suspecting a child to have a pulmonary TB, we want to know if this child has come into contact with an adult with pulmonary TB. Because normally children, because of their low immunity, they are going to be to get this from adults. So that is why we want to know the history of contact. So if presence of two or more of one, the history of contact. Another one, if we have respiratory signs. Respiratory signs are things like fast breathing, we said last time, or a chest x-ray that is suggestive of pulmonary TB. So in a chest x-ray, you find that there are signs of pulmonary TB, like the hilar lymphadenopathies. If we have things like opacifications in the chest, or positive Mantoux test. So if there is, we said first of all the presence of this two or more of the symptoms. We said the cough for more than 2 weeks, failure to gain weight, persistent fever, night sweats, plus two or more of if we have history of contact, respiratory signs, and also the chest x-ray suggestive of PTB and positive Mantoux test. So if you combine these two, then pulmonary TB is likely and treatment is justified. So if you have this combination, then we are right to say this is pulmonary TB and we can now start on treatment. And the treatment is now the use of anti-TBs, those drugs we use to treat TB. So then, the anti-TB drugs used in children, I can just name them. The names might be a bit hard, but I can just mention them. So it is usually a combination of drugs. So we don't use a single drug. It is usually a combination of this anti-TB. So just by the mention, we have number one, a drug anti-TB is one we call isoniazid, and it is usually abbreviated as H. So isoniazid. We have rifampicin, that is abbreviated as R. We have streptomycin, abbreviated as S. Pyrazinamide is abbreviated as Z. And then lastly, we have ethambutol, abbreviated as E. So these are the names of the anti-TBs that we normally have. And we are saying we don't use just one drug. What we do a combination of them. So treatment of, having said the names of the drugs, the names of the anti-TBs, now we go direct to the treatment of now the TB. We have some types of tuberculosis disease. So one, we have a classification known as non-severe form. The non-severe form, number one now, is the pulmonary tuberculosis, just pulmonary tuberculosis. It is in a class of non-severe form of the disease. Another example, we have TB adenitis. We have the adenoids, so the TB of the adenitis. Maybe I can mention this before we go on. Tuberculosis affects every part of the body, every organ, apart from the hair, the teeth, and the nail. So that tells you that it can affect any other part of the body, just only the nails, the hair, and also the teeth. So any other part, tuberculosis, we can get. That is why we are saying TB adenitis. That is the adenoids have got this tuberculosis. So these are forms of the non-severe forms of the disease. Now, another type, we have another classification of now the severe forms. The severe forms of TB, we have number one, severe pulmonary TB. Unlike the first non-severe, we had just pulmonary TB. So what do we mean when we come to the severe forms and we say severe pulmonary TB? This one is severe because here we have respiratory distress. These babies, these children are unable to breathe normally. They have difficulties in breathing. We also have extensive lung involvement when it comes to the chest X-ray. The lung is really involved, and the TB has really damaged these lungs. This is what we are meaning by saying extensive lung involvement. That is the severe pulmonary TB. In also another examples under severe pulmonary TB is extrapulmonary TB. When we say extra, we mean the TB is somewhere else apart from the pulmonary. It is somewhere else apart from now the pulmonary, apart from the lungs. So example, we call it miliary TB. It is all over. We have the TB of the abdomen. We have the TB of the bone. We also have joint TB. So remember, we said it's only the nail, the hair, and also the teeth that do not get this TB. Otherwise, TB affects every other organ. You can imagine it is this sensitive. I know this, maybe you didn't know. People only know of pulmonary TB that affects the lungs. So we also have under still severe forms of the disease, we have TB meningitis. Imagine it has gone to an extent of affecting the meninges, the head, the central nervous system. Very, very serious. So this we call TBM or TB meningitis. So I hope this is clear. This is very, very clear. So another thing, we have another form that is the retreatment. It is another classification, if I may say, retreatment. This is whereby if someone was treated for pulmonary TB and again they come back with the same symptoms after a few times, others go and default, so you need to restart the treatment. So this is what we are calling now the retreatment. Hope this is very, very clear. So now let's go to the treatment itself now. We have seen the forms. So the treatment, we have two ways. We start something we call the initial phase of treatment, the initial form of treatment, and also we have the continuation phase. So what do we mean by this? So the non-severe forms, the TB that is not so severe, we normally do the 2 months of intensive phase. Yes, we normally do 2 months of intensive phase. And we come to continuation phase, we do 4 months. So what happens, maybe if I can explain the difference between the initial phase and the continuation phase is that maybe in the initial phase you had a combination of 4 drugs. Remember we said it's not a one drug thing. We use the combination of these anti-TBs. So the only difference you find is that in the initial phase, you use like 4 drugs, but in the continuation phase, you might use 2 or even 3, depending on the type of the TB that you are treating. Hope this is clear. So in non-severe forms, we are saying the initial phase, for the first 2 months, we use 4 drugs, while the continuation phase, we do 2 drugs for 4 months. So this is a total of 6 months of treatment of TB. I hope this is clear. When we come to severe forms, you might find that we have 2 again initial phase. For the first 2 months we use 2 months, and also the continuation phase we use now again 4 months, but there is change of the medications. We switch medications. The combination, the drugs are the same, but we use combinations that are different. This is what we mean. When we come to retreatment, this is something that has not, we are now retreating, we're doing the retreatment again, like for examples of defaulters, I said that, those who reached somewhere, they did not finish the medications, there was no compliance to these anti-TBs, and normally we have to finish the dose. This for the, if it is 6 months, it has to go up to 6 months. So for the retreatment, normally we do, unlike most of them, the initial phase we use 4 drugs. Here we use like 5. We add a drug called the streptomycin, still was under the drugs used for the TB. So we use 2 months. Then we do 1 month of 4 drugs. We remove again the streptomycin. And the continuation phase we do for 5 months with 3 drugs. So in total, when it comes to retreatment, you find that you are going to use, in initial phase, you do 2 months with 5 drugs, and then 1 month without 1 drug, so they become 4. Then continuation phase, we use 3 drugs for 5 months. So in total, you find like 2 plus 1, 5, so like 8 months. You find yourself treating the retreatment for 8 months depending. And we are saying retreatment if those people who defaulted, they did not comply to the drugs, to the treatment. So of course we have to treat for longer. The drugs are the same. What changes is the duration. We treat for longer because whenever the TB comes back, the strains become difficult to treat. So that is why we use the same drugs but different. The same drugs, same dosages, but a longer time. A longer time, we are saying around 8 months. I believe we are continuing on together, and now you know, at least you know, you have the knowledge on TB treatment. What really comes to your mind, the TB treatment. And remember, TB is it is usually you give to another person. It's easily transmitted, and the transmission is through droplet inhalation. So that is why we want to hurry up to start the treatment early, so that you do not it is not transmissible very fast to another person, because we are saying it is through the droplet inhalation. So thank you, my people, for listening. We'll still continue with this. The TB again is wide. Remember, we are still doing TB under HIV in children. So thank you so much for your time. If you haven't subscribed, I again remind you, please kindly hit on the subscribe button. Also, turn on your notifications so that you may know, you may be among the first people to know every time I post a new video here. Also, comment in the comment section. If you have any questions, please ask. Comment in the comment section. Also, my email is provided in the end of every video. You can slide to the email, just write me, and I'm going to reply to your comments. Thank you so much. Till next time, bye-bye.